Nigerian government has launched a social behavioural campaign aimed at curbing the spread of COVID-19. The campaign is a collaboration between Nigeria's Centre for Disease Control, Nigeria's National Orientation Agency, the United Nations Children and Education Fund, the European Union, and the Centre for Communication and Social Impact, CCSI. It will run for 4 months and calls for quick attitudinal change by Nigerians. The campaign would also focus on Nigerians at the grassroots obeying basic COVID-19 safety protocols. News Central correspondent Amadine Uyi has the story.
With over 160 million persons affected by the COVID-19 pandemic worldwide, about 3.3 million deaths have been recorded. Nigeria has had its own fair share of infections, recording about 165,000 confirmed cases, with about 2,000 deaths. Many believe the devastating effects of the COVID-19 would have been avoided if Nigerians had obeyed simple COVID-19 prevention protocols.
COVID-19 pandemic has affected access to essential health services and our social way of living. However, the poor adherence to preventive behavior by individuals, households, and the community continues to contribute substantially to the spread of COVID-19 in the country.
While the fear of a third wave of the pandemic looms, experts in Abuja, Nigeria's federal capital, have launched a social behavioral change campaign. They say the campaign will focus on behavioral change, drawing its strength from its simplicity.
The Powerful Hands campaign, which we are here to launch, may seem so simple compared to diagnostics, compared to vaccines, compared to therapeutics, compared to assuring oxygen supplies, compared to finding vaccines where there are none. But this is what is in our hands currently. It is what we have power over.
In the wake of the third wave across a number of countries, the time to proactively take action is now.
The campaign will also urge Nigerians to act swiftly, making major adjustments to public attitude and attitudinal change.
Our behaviors continue to be very important. And as much as we appreciate the advancements in tools, we must also recognize that the future of this outbreak still lies in our hands.
The power to stop COVID is in our hands. And as Dr. Chikwe said, the 5 fingers represent each of an element of what we as individuals and collectively can do to ensure that we are protected.
And once you get these pillars right, the pillars of changing behavior, pillars of things that you can do easily, it's easy to build on the other components of the campaign, of the response, like testing, like vaccination. So I can tell you, if I don't believe I need to wash my hands, I'm most likely not going to get vaccinated. So let's get the long-term behaviors right. And these behaviors are really key, even beyond the pandemic.
They urge Nigerians to take ownership of the campaign and take charge of their destiny.
Today, the figures are low, but tomorrow we don't know. And unless today we do something about tomorrow, tomorrow will bite back, and we will have no chance to go back to where we were.
Change must begin with us as individuals, as a collective, and at community levels.
From Abuja, Amadine Uyi, News Central Television.
You're watching News Central.